Thanks for staying with us. Genetic testing for cancer is an intriguing and controversial topic. A genetic counselor can help you understand how it's used and who can benefit. And we have a genetic counselor with us today, Durda from Mercy's Hall-Perrine Cancer Center. Kate, thanks for coming in today.
Thanks so much for having me.
You bet. And what can we learn about our health from genetic testing?
Well, there's a lot of different genetic testing out there, so I primarily see patients who've had either a personal or family history of cancer and identify the patients who might be at a higher risk of developing cancer. So probably about 10% of all cancers are hereditary, meaning we can pinpoint something genetic that someone's born with that will cause them to have an increased lifetime risk of cancer.
So how does this process work?
Yeah, that's a great question. So usually patients come in to meet with a healthcare professional who has specialized training in genetics to go over their history and also their family history. So we start getting concerned when we see people who are diagnosed at a younger age with cancers or multiple family members with cancers and certain types of tumors. And so basically the genetics professional can go over that history and identify if that person would be appropriate for genetic testing and talk about the options for testing. There's a lot of different tests out there now, and kind of talk through different options the patient might have, help with insurance issues, and talk through the pros and cons. Obviously, there's also concerns with genetic discrimination, and there's some laws in place with that, and also cost for the testing. So we can kind of guide someone through that process, help them make a decision about whether or not they want to do testing. Even if someone doesn't do testing, there may be additional screenings we'd think about. So if there's an early history of colon cancer in the family, we might encourage that person to think about colonoscopies, younger than general population guideline of 50 to start screening and things of that nature.
And you're kind of leading right up into my next question, which is, who's a good candidate for this, and maybe also importantly, who is not appropriate for this type of treatment?
Yeah, so like I said, most cancers aren't hereditary. Most cancers are sporadic and just happen by chance. So we're looking at the family history, seeing if it meets current professional guidelines to offer someone testing based on our current research knowledge. And then we'd like to start out testing with somebody in the family who's had a history of cancer, if that's possible. They're the most informative relative to test because not everyone in a family will carry a genetic change putting them at higher risk. But sometimes we run into situations where relatives have passed away or they aren't interested in testing, so then we just have to be more careful with how we interpret someone's results if we don't identify a genetic change.
Sure. This is a lot of information to take in, and as we mentioned, it's kind of a controversial topic and something that you can really benefit from talking to a genetic counselor about. And you've got a webinar coming up tomorrow about this.
Yes, so we're doing a webinar tomorrow talking specifically about genetic testing for cancer and genetic counseling for cancer. We get a lot of questions from people, what exactly is genetic counseling? How does this whole process work? And so we're hoping that this will help provide people with some information about some of the insurance-related issues, how genetics professionals are trained, what type of information they might get from genetic testing. So I'd encourage people to sign up for the webinar. And I know it's at noon tomorrow. I know not everyone will be able to make that time, so it is going to be recorded and archived on the Mercy website as well for later viewing.
That website up on your screen right now, mercycare.org/live, if you are able to join in on that webinar. Again, it's free, happening at noon tomorrow about genetic counseling and genetic testing for cancer. Kate, thank you so much for coming in today.
Thank you.